Mental health in Australia. A growing concern. Mental health is a critical aspect of overall well-being. In Australia, mental health issues are increasingly prevalent. They affect people of all ages, backgrounds, and walks of life. Recognizing the significance of mental health is crucial for building a healthier and more supportive society. Mental health disorders can manifest in various ways. They often impact thoughts, feelings, and behaviors. These disorders can range from anxiety and depression to more complex conditions like bipolar disorder and schizophrenia. The stigma surrounding mental health often prevents individuals from seeking help. This can exacerbate their conditions and create barriers to recovery. Addressing stigma is essential to encourage open conversations and support seeking behaviors. It is vital for Australians to understand the importance of mental health. We need to create an environment where individuals feel comfortable discussing their struggles. By prioritizing mental well-being, we can foster a more compassionate and understanding society. The face of mental illness. Statistics and expert insights. Statistics paint a clear picture of the prevalence of mental health disorders in Australia. According to the Australian Institute of Health and Welfare, 1 in 5 Australians aged 16 to 85 experiences a mental illness each year. This equates to approximately 5 million people facing mental health challenges.
The most common mental illnesses in Australia include anxiety disorders, depressive disorders, and substance use disorders. These conditions can have a profound impact on individuals, families, and communities. Early detection and treatment are crucial for improving outcomes for individuals with mental illness.
However, access to mental health services remains a significant challenge in Australia. Long wait times for appointments, high costs, and limited availability of mental health professionals in rural and remote areas pose barriers to care. Beyond the surface, understanding different mental disorders. Mental health disorders encompass a wide spectrum of conditions, each with its unique characteristics and impacts. Anxiety disorders, characterized by excessive worry and fear, are among the most prevalent mental illnesses in Australia. Individuals with anxiety disorders may experience panic attacks, social anxiety, or generalized anxiety disorder, GAD. These conditions can significantly impair daily functioning and quality of life. Depressive disorders, on the other hand, are characterized by persistent sadness, loss of interest, and feelings of hopelessness. Major depressive disorder, MDD, is a common type of depression that can have debilitating effects. Bipolar disorder is characterized by extreme mood swings between periods of mania and depression. Individuals with bipolar disorder may experience intense highs and lows that can significantly disrupt their lives. Schizophrenia is a complex mental disorder that affects a person's ability to think, feel, and behave clearly. Symptoms may include hallucinations, delusions, and disorganized thinking. The youth factor. Mental health challenges for young Australians. Young Australians face unique mental health challenges in today's rapidly changing world. The pressures of education, social media, and finding their place in society can take a toll on their mental well-being.
Statistics indicate that 1 in 7 young people aged 4 to 17 experiences a mental health condition in any given year. Anxiety and depression are the most common mental illnesses among young Australians. Factors contributing to mental health issues in young people include academic pressure, bullying, social isolation, and family problems. The rise of social media has also been linked to increased rates of anxiety and depression among youth.
Early intervention and support are crucial for young people experiencing mental health difficulties. Schools, families, and communities play a vital role in creating a supportive environment for youth mental health. Adulthood brings its own set of mental health challenges. Work-related stress, financial pressures, relationship issues, and parenting responsibilities can impact mental well-being. Burnout, a state of emotional, physical, and mental exhaustion caused by prolonged or excessive stress, is increasingly common among adults. Midlife can also be a time of transition and reflection, which can sometimes lead to mental health challenges. Symptoms of burnout include cynicism, detachment, and a reduced sense of accomplishment. The midlife crisis is a popular concept that reflects the emotional and psychological adjustments that can occur during this stage of life. Maintaining good mental health during adulthood involves prioritizing self-care, seeking support when needed, and engaging in activities that promote well-being. Mental health disorders can affect anyone, regardless of gender. However, there are notable differences in the prevalence and expression of mental illness between men and women. Women are more likely to experience anxiety and depression, while men are more likely to suffer from substance use disorders. Societal expectations and gender norms can influence help-seeking behaviors and coping mechanisms. Men are often reluctant to seek help for mental health issues due to stigma and societal expectations of masculinity. This can lead to men suffering in silence and their conditions worsening over time. It is essential to promote mental health awareness and support for both men and women. Creating a culture where individuals feel comfortable discussing their mental health, regardless of gender, is crucial. Seeking support is crucial for individuals experiencing mental health challenges. However, several barriers can prevent individuals from accessing the care they need. Stigma surrounding mental illness remains a significant barrier to seeking help. Many individuals fear judgment or discrimination if they disclose their mental health struggles. The cost of mental health care can be prohibitive for some individuals, particularly those without private health insurance. Long wait times for appointments with mental health professionals can also be a deterrent. Limited availability of mental health services in rural and remote areas poses a significant challenge for individuals living outside major cities. Addressing these barriers is crucial to ensure that all Australians have equitable access to mental health care. Triumph over trouble. Stories of recovery and resilience. Real-life recovery stories provide hope and inspiration to individuals struggling with mental illness. They demonstrate that recovery is possible and that there is light at the end of the tunnel.
Meet Sarah, a young woman who battled severe anxiety and depression for years. Through therapy, medication, and the support of her loved ones, Sarah was able to manage her condition and regain control of her life. John, a successful businessman, struggled with alcoholism for many years. After hitting rock bottom, he sought help and joined a support group. Today, John is sober and uses his experience to help others.
These stories highlight the power of resilience, the importance of seeking help, and the transformative potential of recovery. They serve as a reminder that mental illness does not define a person and that there is always hope. A helping hand resources and support systems in Australia. Australia offers a range of resources and support systems for individuals experiencing mental health challenges. Beyond Blue, Lifeline, and the Black Dog Institute are just a few organizations providing valuable information, support, and resources. Beyond Blue is a national mental health organization that provides information, support, and resources on anxiety, depression, and suicide prevention. Their website offers a wealth of information, including personal stories, tips for managing mental health, and details about support services. Lifeline is a crisis support and suicide prevention service that provides confidential phone, text, and online support 24/7. Their trained crisis supporters offer a listening ear, emotional support, and practical assistance to individuals in crisis. The Black Dog Institute is a world-leading research organization dedicated to understanding, preventing, and treating mental illness. They offer a range of resources, including online programs, mobile apps, and fact sheets on various mental health conditions. Fostering a mentally healthy community. What can we do? Creating a mentally healthy community requires a collective effort. We all have a role to play in promoting mental well-being and supporting those struggling with mental illness. Educating ourselves about mental health is crucial. Understanding the signs and symptoms of mental illness allows us to recognize when someone might be struggling and offer support. Reducing stigma surrounding mental illness is essential. We can do this by talking openly about mental health, challenging negative stereotypes, and encouraging help-seeking behaviors. Supporting mental health initiatives and organizations is another way to make a difference. Donating to or volunteering with organizations like Beyond Blue, Lifeline, and the Black Dog Institute can help provide vital services to those in need. A brighter tomorrow, embracing hope for mental wellness. Mental health is an integral aspect of overall well-being. By prioritizing mental health, we can create a healthier, happier, and more supportive society for all Australians. Remember, there is always hope. Recovery is possible, and with the right support, individuals can overcome mental health challenges and live fulfilling lives. Let us continue to work together to break down stigma, increase awareness, and ensure that everyone has access to the mental health care they need. Together, we can create a brighter tomorrow for mental wellness in Australia